Welcome back! I'm glad that we are all here, even if it is somewhat virtually, but we are going to spend a lot of this semester covering chapter 11 of our textbook, which has to do with the positioning of the skull, facial bones, and sinuses. And because they're pretty detailed, we're going to, like I said, take our time to really make sure that we can get it right. Now, there's debate about whether or not this is super necessary, with CT kind of taking over a lot of the, brain and skull imaging. But in those rare cases when you're going to need it, and how I always try to remind you guys that you have to pretend that you somehow end up in Timbuktu and there is no CT available, what would you do if you needed to get a really good skull image? So this is, again, a skill we still want you to have, so that you're prepared for anything that should happen or could happen in your life. So we're going to start with the skull. So the skull kind of incorporates both the cranium and the facial bones. So there's 8 cranial bones and there's 14 facial bones. Now, for the first part of this semester, we're going to focus a little bit more on those cranial bones, and then we'll move into the facial bones as well. So our 8 cranial bones that we want to focus on are the frontal, the right and left parietal, right and left temporal, the ethmoid, the sphenoid, and the occipital bone. So again, it's important to kind of differentiate the ones that are single, the ones that come in pairs, and again, make sure that we really are familiar with the relationship of where they are to each other, how they connect, and what this means for the underlying anatomy. So, like we said, connection is important, and that happens via cranial sutures and specific junction points. So our cranial sutures that we want to focus on are the coronal, lambdoidal, squamosal, and sagittal. Again, really important to know where they are, what they connect, and kind of their general pattern. So as you can kind of see, some of them are a little bit more squiggly. Some of them have the kind of like Y shape or curved shape. So again, just becoming very familiar with what they are, what they do, what they connect. There's also junction points, and they have really fun names. Asterion, bregma, one of my favorites, lambda, and pterion. Now again, it's debatable whether or not that P is supposed to be silent or not, but I like saying the P, so we're just going to go with it. Also, our cranium and skulls are kind of fascinating in the fact that they continue to sort of develop and grow as we develop and grow. So the infant cranium is much different than the adult cranium. And part of the infant cranium is fontanelles. So a lot of times those are those soft spots that you'll hear parents talk about with their infants. Be careful with the soft spots. You don't want to do any of those sorts of things. And they're kind of membrane-covered areas until our skull develops and kind of fills those areas in. So the 6 fontanelles to be aware of are the anterior and posterior, the right and left sphenoid, and the right and left mastoid. So we also want to discuss a little bit of the skull morphology and topography. And again, if we were in class, I would try to show you a few different skulls of, again, just different body habituses or just different skull types. Different ethnic groups can also have different trends with how their skulls are positioned, and there's slight differences. But we'll go through some of them and hope that, like I said, we can demonstrate maybe some of those things in lab, and take a look at, again, those variations that we have. So the first one we're going to start with is a mesocephalic skull. So this is the skull with the average shape. So So the width is roughly 75 to 80% of the length. And it's the most common. Like I said, it's your average. It's the one that sort of, keeps all of the generalized images of when you see a skull, that's what you think of. Also, we have brachycephalic and dolicephalic. So the brachycephalic now is that your width is 80% or more of the length. So you can think of that as sort of your wide. So people who have kind of these wider skull shapes. And then the other one, the dolichocephalic, is where you have a very narrow. So its width is less than 75% of the length. So, someone who has a slightly more narrow build to their skull. There's also really important planes and landmarks. And these, again, I can't reiterate enough to really get these down throughout the semester. Like I said, we will keep coming back to these reference points over and over and over again. And to, again, notice that there might be some variation. So, most important is to kind of realize where the mid-sagittal plane of someone's skull may be. The glabella, which is kind of that area right in between and slightly maybe above the brow area. You also have the nasion, which is going to be kind of right at the tip of your nose. I like to think of it as where my glasses like to rub up against, at least when I push them all the way back before they start sliding down my nose again. The acanthion, which is that spot that's just underneath the cartilage in between your nose. So that part there. You also have the mental point, which is kind of the tip of your mandible or your chin. If we move over to the right side of the image here, we have the supraorbital groove. Again, if you have ever seen sort of the like gorilla skulls or things, that they kind of have this very pronounced ridge, and so there's this area that's above that called the supraorbital groove, where it goes back to kind of being up against the flat of the forehead. The superciliary ridge, basically that's your brow line. You also have the interpupillary line. So again, that's sort of drawing a line between your pupils. This will help you kind of prevent any tilt. So it's an important one to know. And then the very last one is your angle of your mandible or your gonion. Another one of my favorite words. So again, some of those same things, but now from a lateral perspective and adding a couple others that we didn't see before. So again, if you start on the left side of the image, we're also going to focus a little bit on the ear here. So you have the top of ear attachment with the T-E-A. There's the auricle or the pinna, which is the cartilage portion of your ear. You have the targus, which is an area that people can pierce sometimes, but again, it's kind of sensitive. I've heard it's really intense if you get that pierced. And again, they haven't mentioned it yet, but the hole in the middle would be your external auditory meatus, or your EAM. It's another really important positioning landmark. Again, you can kind of see the area of where they have the glabella, the nasion, the acanthion, and the mental point, as well as the angle or the gonion. And then if we want to get specific to landmarks of the orbit, so we have the inner canthus versus the outer canthus. Again, this is going to kind of help with your interpupillary line, whether or not that's in line with it or not. Again, may vary depending on ethnic group. You also have the SOM and the IOM. So the superior orbital margin, that's what the SOM stands for. And then the IOM is the inferior orbital margin. And then you have the midlateral orbital margin on the side as well. So, again, the midlateral orbital margin and the outer canthus, basically kind of the same thing. But again, we also have this superior and inferior orbital margins as well. So, because we love our positioning lines and we also love to make them abbreviated, we have a whole list of things that we tend to use when we're describing how to position a skull. So, we have the acanthomeatal line, so the AML, kind of here in the middle. You have the lips meatal line, so going from the lips to the external auditory meatus, EAM. We have the mental meatal line, so the MML, the glabellomeatal line, or the GML. We have the orbital meatal line, so the OML, and the infraorbital meatal line, or the IOML. It's also known as Reed's baseline. With additional, up top here, the glabellar alveolar line. And basically, it's another way to describe your mid-sagittal. So, again, really review this terminology and become familiar with it. So, there's a couple positioning aids that you can use, and our little angle measure here is a little bit different, and we'll practice with those in the lab. But you can also use kind of 90-degree blocks or anything else that creates that kind of an angle as a way to sort of position the skull to where you need it to be. We also have a couple other things to keep in mind. Is it more comfortable, or is it required to be erect or recumbent? This is something that's going to come up a little bit later with sinuses and facial bones, about whether or not it's preferred to do upright or lying down. Our SID is typically going to be 40 inches. Like I said, it's really rare that would ever change for the skull. You would want to use a small focal spot to keep your details up, and then of course shielding the radiosensitive organs when you can. So, there's some common things that will happen with positioning the skull. Because again, it's this round ball that we want to try to put into, a flat surface. So there's a rotation issue, there's tilt issue, excessive flexion, excessive extension, or the incorrect CR angle. So these are all areas that can be easily missed or manipulated that will give you a less than stellar, X-ray of the skull. So any of these, positioning descriptors that we use, it's to keep us straight, to keep us from, making these mistakes or these errors, is to really be conscious of what needs to line up, how to line that up, or what to do if one of these things does happen and how to correct it. So, again, when we talk about, things as we continue to position and continue to focus on the projections that we're going to do, this is what we want to kind of prevent, or this is what we want to keep in mind. So here's an X-ray. This is a Caldwell projection, and there are some letters here, and this image is in your textbook. So just make sure that you review it. I'm not going to give you the answers, so make sure that you, again, read the section in the textbook that refers to the anatomy of the skull. And make sure that you, again, are getting familiar with how to identify these structures. Here is the lateral projection. So again, if you can, make sure you print out the slides or follow along with your textbook, and make sure, again, that you can recognize some of these structures, because it's going to be important as we keep talking about our positioning and whether or not things are right or wrong. Will kind of be based a little bit on how these structures look. So again, make sure that you really review that section of the textbook, because we keep building and keep referring back to it. So We want to make sure that our foundation is strong.